We live in a society where knowledge is everything. Data is more valuable than oil. Who would have thought? But with that ownership comes great responsibility and regulatory oversight. When I started the VIOS platform, I was wondering, what kind of data can I ask from people? What should I collect? Where should I store it? And how can I manage it? That's probably a really important question. I realize that every country has their own patient data and citizenship data and all these other regulatory oversight. It's really expensive and kind of complex as well. Like, I'll give you an example. Some countries say that if a citizen uploads any identifiable data, that information should be in a local server. How can I do that? We're a small company which is trying to do big things. We just can't afford it. Patient data is another sensitive topic. I'm sure many of you heard of the HIPAA Act, COPPA, GDPR. There's many more actually. They all state the same thing. Whoever deals with collecting, processing, and storing of such data, it's going to be expensive. Let me break it to you. It's going to be so expensive. So what have I decided? How can a small company trying to scale up manage with so much data? How can we contend with so much regulations? Simple answer is, we won't. Why take the hassle? We've designed the VIOS platform not as a telemedicine company. It's not even a healthcare company. It's purely for communication. And I believe the best way to get the patient data is to extract it the old-fashioned way. History taking, consulting, counseling, and of course, just having conversation. The fact that we're not collecting any patient data upgrades our status to be a bit more, how can I say, trustworthy and credible. Let me put it another way. I don't really care how many people in your family have diabetes or cancer, or maybe somebody has an STD or something. I don't need to know. I don't need to know your insurance coverage, your age, or how many packs of cigarettes you smoke. It's not important. Not to me, at least. I believe you should share that data to people who can really take their responsibility, such as a healthcare provider, who is duty-bound and oath-bound to maintain that confidentiality. Not us, your provider, the person you have chosen. So you may ask, okay, if we're not collecting any patient data, how can we make money? And that's very controversial. I don't want to mention any names, but there are certain tech giants that will monetize your information. They will take your identity and put a dollar value on it. Not us. We don't work that way. We respect your confidentiality. We believe that you are special in your own way, and we preserve it. The best way to preserve patient data is not to ask for it. That's what I believe. I believe data belongs to the people, and it's your right whether you want to share it or not, and with whom. So that's pretty much what I want to say. How do we collect patient data? How do we manage all that information? We don't. That's not our job. Our job is to improve consultation access, knowledge sharing, information gathering, making the right informed choice. So that's it for now. Be careful who you share information with, and believe me, trust is everything.